Welcome back. You may have seen the video out of St. Louis, a husband and wife out of their home pointing guns at people walking down the street protesting the city's mayor. Mark McCloskey says they were in fear for their lives. Now, despite the claims, video circulating on social media shows protesters opening and walking through an unbroken gate. It's not clear, though, when the gate was damaged or who destroyed it.
It was like the storming of the Bastille. The gate came down and a large crowd of very angry, shouting, aggressive people poured through. I was terrified that we'd be murdered within seconds, that our house would be burned down, that our pets would be killed.
An attorney for the McCloskeys says they support the Black Lives Matter movement and that peaceful protesters were not the subject of scorn or disdain by the couple. According to profiles on their firm's website, the McCloskeys both graduated from SMU School of Law right here in North Texas. When COVID cases go up, ER visits for non-COVID reasons go down, and that has many doctors worried that their patients may be avoiding care that they desperately need. It's today's Ones for Wellness. A new report from the CDC found Americans have either delayed or declined emergency care because of the pandemic, and local doctors fear in Texas that it will only get worse.
We still have no-shows.
Dr. Farhan Ali, a cardiologist at Heart Center of North Texas, says some of his patients have been putting themselves in danger by delaying care.
And I can think of 10 patients over the last 2 weeks that have been in the hospital with heart attacks, that they've had worsening heart failure.
He says it's not just the fear of the coronavirus that's delaying care. The recent announcement by the governor to once again halt elective procedures could complicate current cases.
In March, we had a halt of elective procedures. So we weren't allowed to do elective procedures in the hospital that were considered non-emergent, for example. And so those started stacking up and building a backlog.
Kenneth Don Davis was supposed to have heart surgery in late March. The cancellation due to the lockdown complicated his case.
I was having pain down my arm when I walked maybe a half a block. I had burning in my chest also.
Davis lived through the pain for almost a month, but at the time felt as if he had no other choice.
I was worried. My wife was worried also. Yes, I was worried that I might have another heart attack and have to go in and have more work done.
Dr. Ali says patients need to understand that routine and preventative care saves lives.
If I had to go to a doctor right now, I would feel more comfortable with a mask on, coming in and seeing the physician. I think that your chances of getting coronavirus are probably higher out in the community than they are in the hospital.
Davis finally had his surgery in May, weeks after his initial surgery date. Fortunately for him, while late, it was not too late.
I felt real good because I knew that I was going to be pain-free again, where I could, walk with my wife around the neighborhood. I was real happy, to get it done.
A recent advisory from Medicare also urges patients to not put off necessary care, saying it can lead to more complications. The Texas Medical Association is urging patients to continue getting preventative checkups for chronic conditions like diabetes and blood pressure, as well as cancer screenings.